Welcome to today's explainer. Think of me as your friendly neighborhood geriatric doctor. I'm absolutely thrilled you've joined us because today we're tackling something that affects literally millions of us once we cross that fabulous milestone of 50, our spine. You know, we constantly blame every ache, creak, and groan on simply getting older. But what if there are actually hidden nutritional causes behind those aging spine problems? Today, we're going to look closely at the essential nutrients and everyday habits that can keep your back strong, flexible, and pain-free well into your golden years.
Okay, let's dive into this. Have you ever wondered, is a simple vitamin deficiency causing your back pain? It's a huge question, right? Millions of Americans over 50 struggle with chronic back pain, weak bones, and mobility issues. And honestly, too often, this slow decline leads to injections, heavy medications, or even major spine surgery. But here's the validating truth. Your chronic pain might not just be getting old. A lot of doctors and researchers now believe nutritional deficiencies play a massive role here. It's often a highly treatable nutritional gap that we can actually do something about.
Now, I want to acknowledge what many of you might be feeling right now. Let's just consider this our waiting room check-in. You might be intimately familiar with these issues: lower back pain, herniated discs, sciatica, osteoporosis, spinal stenosis, poor posture, and limited mobility. As we age, our spine naturally changes. The discs between our vertebrae lose their hydration and flexibility. It's almost like a sponge drying out. Our supporting muscles shrink, and inflammation slowly builds up over time. But while age absolutely plays its part, lifestyle factors like poor nutrition, a lack of sunlight, and vitamin deficiencies, well, they can speed up this spinal degeneration dramatically. Moving on to Section 1, the hidden culprit, vitamin D.
So vitamin D is basically the foundational nutrient your body requires to absorb calcium properly. Without enough of it, the vertebrae in your spine can become weak, brittle, and highly vulnerable to fractures. Think of this like a symptom checklist during a clinic visit. We're looking at fatigue, muscle aches, bone pain, weakness, frequent falls, depression, and of course, back pain. Research has firmly linked low vitamin D levels with chronic lower back pain and increased inflammation. And the really scary part, a massive percentage of adults over 50 suffer from these exact issues simply because they're deficient in vitamin D, especially those of us who spend most of our time indoors. But here's the thing, vitamin D doesn't work alone. It has a missing partner, vitamin K2. Think of this like a medical synergy. Vitamin D unlocks the door, right? It absorbs the calcium from your diet. But vitamin K2 is the traffic cop. It safely directs that calcium directly into your bones exactly where it belongs, instead of allowing it to dangerously build up in your arteries or soft tissues. This is exactly why many spine and bone health experts now highly recommend combining D3 and K2 together for optimal spinal stability, bone strength, and a healthy calcium balance. All right, Section 2, nutritional support, building your plate.
Now, what's really interesting about this slide is how we can fix this through our diet. While supplements are often a really necessary tool, beautiful, healthy food is always our first and best foundation for healing. Here's your daily cheat sheet for these nutrients. For vitamin D3, to get that crucial calcium absorption, you want to look at delicious sources like salmon, fortified milk, sardines, tuna, and egg yolks. And to get your vitamin K2 for calcium placement, you can turn to hard cheeses, fermented foods, grass-fed dairy, and yep, those wonderful egg yolks again. Of course, vitamin D levels also improve through sunlight. A fantastic starting schedule is just 15 to 20 minutes of midday sun exposure about 3 times a week. But please always remember to consult your own doctor before starting any new supplement routine.
Okay, now let's introduce the supporting cast of nutrients, starting with magnesium. Magnesium is an absolutely critical mineral for muscle function, nerve signaling, and controlling inflammation in the body. When your magnesium levels drop, it can lead to a whole host of secondary back problems. We're talking muscle cramps, tightness, nerve discomfort, chronic tension in the back, and even poor sleep. And remember, deep sleep is when your body releases human growth hormone to repair micro tears in your spinal discs and muscle tissues. Without that vital recovery time, inflammation just continues to build. Let's look at how to get these into your daily routine. Here are some fantastic healthy snacks rich in magnesium and vitamin B12 for our nutritional prescription. For magnesium, to relieve that tightness and those awful cramps, try snacking on almonds or pumpkin seeds, or maybe add some spinach, black beans, and avocados to your meals. And then we have vitamin B12, which you'll find in meats, fish, and dairy. B12 is absolutely essential for nerve health and healthy blood flow. And this is a super important point for my over 50 crowd. Our B12 absorption decreases significantly as we age, so we really have to pay attention to our intake. Now, I do want to gently warn you about what happens when we miss out on B12. Take a look at these warning signs: numbness, tingling, balance problems, and nerve pain. These are highly uncomfortable nerve issues that can severely impact your quality of life and your mobility. It really just reinforces that nutrition is a full package deal when it comes to your spine and your nervous system.
Let's move to section 3, physical therapy and daily habits.
So we've talked extensively about what to consume, but vitamins alone just aren't enough. We need to pivot to what you should physically do every single day to protect that aging spine. Let's walk through this daily regimen step by step. First, walk every day. Walking improves circulation, muscle strength, and mobility. Second, strengthen your core with 3 simple spine-safe exercises: gentle pelvic tilts, the bird dog stretch, and modified planks. A stronger core acts like a natural support system, significantly reducing the pressure on your lower back. Third, improve your posture. Poor posture puts enormous, unnecessary stress on those spinal discs. Fourth, stay hydrated. Remember how we said aging discs dry out? Well, your spinal discs actively need water to stay flexible and healthy. And fifth, maintain a healthy weight. Extra body weight simply increases the mechanical stress on your lower back. Even small lifestyle changes here make a huge difference over time.
And finally, section 4, doctor's orders, when to get help.
While building healthy habits and taking your vitamins are fantastic proactive steps, they aren't magic cures. There are times when a new back pain or specific symptom requires you to step away from the vitamins and seek immediate professional medical intervention. Please pay close attention to these red flag, non-negotiable warning signs: severe numbness, loss of bladder control, sudden weakness, difficulty walking, or intense worsening pain. If you experience any of these, it means it's time to stop everything and visit a healthcare professional immediately. These could be signs of a much more serious spinal condition that requires a doctor's immediate care.
So the crucial point is this: combined with vitamin K2, magnesium, B12, healthy movement, and proper nutrition, you can give your spine the support it truly deserves. Protecting your spine becomes more important than ever after 50, and vitamin D really is one of the most vital nutrients your body needs to maintain its strength. It's all about holistic, proactive spine care. I want to leave you with this final, incredibly important question. Have you ever actually checked your vitamin D levels? It's such a simple test, but it can provide a wealth of answers about your current pain and your future mobility. I highly encourage you to ask your doctor about this at your next visit. Empower yourself with this knowledge. Thank you so much for joining me for this explainer today. Keep moving, eat well, get a little sunshine, and take wonderful care of that spine.